What is the difference between adrafinil and modafinil? Have you ever wondered how two similar sounding substances can have such different effects on the body? Today, we will break down the differences between adrafinil and modafinil, especially in the context of addiction and substance abuse. Adrafinil and modafinil are both synthetic stimulant drugs designed to promote wakefulness and reduce fatigue. They are often used to enhance alertness and cognitive function. However, they have some key differences that are important to understand. First, let's talk about their chemical relationship. Adrafinil is a prodrug, which means it gets converted into modafinil in the liver. This conversion process makes adrafinil take longer to kick in compared to modafinil, which acts more quickly once ingested. Next, we have potency and dosage. Modafinil is much more potent than adrafinil. To feel similar effects from adrafinil, you would need to take a higher dose. Typical doses for modafinil range from 100 to 200 milligrams per day, while adrafinil doses can be between 300 and 600 milligrams, sometimes even reaching 1200 milligrams daily. When it comes to onset and duration, modafinil reaches peak blood levels within 60 to 90 minutes, providing quicker relief from sleepiness. Adrafinil, on the other hand, can take up to an additional hour to reach its peak levels due to that liver metabolism. One important factor to consider is liver toxicity risk. Adrafinil carries a higher risk of liver strain, especially with prolonged use or high doses. Some users have experienced elevated liver enzymes, which raises concerns for long-term use. Modafinil does not share this same level of risk. In terms of legal status, modafinil is a prescription medication approved for conditions like narcolepsy and shift work sleep disorder. It is classified as a schedule for controlled substance, indicating a lower potential for abuse. Adrafinil, however, is not approved as a prescription drug and is often obtained as a supplement or research chemical, which raises concerns about regulation and safety. Both substances have stimulant properties and can be misused. Modafinil is generally considered to have a lower addiction potential than stronger stimulants like Adderall. Adrafinil's addiction potential is less studied but remains a concern due to its stimulant effects and the risk of liver damage with chronic use. Side effects can also vary. Both adrafinil and modafinil may cause increased heart rate, anxiety, and insomnia. However, adrafinil may lead to more serious heart or psychiatric side effects, and its potential for addiction is something to keep in mind. In summary, while both adrafinil and modafinil serve similar purposes, they differ significantly in their chemical makeup, potency, and risks associated with use. Understanding these differences is essential, especially when considering the potential for addiction and the impact on health. Always approach these substances with caution and seek medical advice when necessary.